Let's talk about substance and medication-induced major or mild neurocognitive disorder. Substance and medication-induced major or mild neurocognitive disorder can be specifically coded for alcohol if the substance is the cause of neurocognitive symptoms. In addition to listing the specific substance, for example, alcohol, the DSM-5 specifies whether the symptoms are persistent, that is, the neurocognitive impairment continues even after the substance use has ceased. Major neurocognitive disorder, NCD, is diagnosed when there is a significant cognitive decline from a previous level of performance, as noted by a knowledgeable informant, or by documentation from standardized neuropsychological testing. This decline is substantial enough to interfere with complex activities of daily living, such as bill paying, holding a job, managing medications, etc. NCD contrasts with major NCD by levels of severity. Knowledgeable informants note a mild decline, or neuropsychological testings find some modest impairment from previous levels. Mild NCD does not necessarily interfere with activities of daily living, but more effort is put forth to accomplish these activities. It should also be noted that neither mild nor major NCD is better explained by delirium or some other mental disorder. The rate of mild NCD is approximately 30 to 40% in the first 2 months of alcohol abstinence. Mild persistent NCD is more likely in individuals who achieve abstinence after the age of 50. Nutritional deficits are one complication that increases the likelihood of major NCD after alcohol abuse. Associated with major NCD due to prolonged alcohol use is a tendency to confabulate experiences that actually did not take place. Symptoms of alcohol-related mild or major NCD include memory impairments, executive dysfunction, for example, difficulty in organizing or planning, and visual spatial deficits in spite of intact sensory function. Individuals with alcohol-induced major or mild NCD are less likely to demonstrate aphasia, that is, language impairments, than are individuals with other forms of dementia. In some instances, suspending alcohol use leads to improvements in cognitive functioning. Oftentimes, however, the damage is permanent and irreversible. Let's practice with the question for substance and medication-induced major or mild neurocognitive disorder. Bob, a 60-year-old man, has been diagnosed with neurocognitive disorder, substance and medication abuse. Which of the following statements is likely to be characterizing Bob's functioning? Answer A. Bob is suffering from memory impairments. Answer B. Bob is demonstrating disturbances in his use and understanding of language. C. Bob is unable to effectively engage in abstraction. Or answer D. Bob has difficulties in sustaining or shifting attention. Answer B is the correct answer, as neurocognitive disorder substance and medication use, previously known as alcohol-induced persisting dementia, is not necessarily associated with deficits in the ability to use and understand language. Memory impairments, answer A, are the hallmark of dementias. Answer C and D, abstraction, sustaining and shifting attention, are executive dysfunctions, highly likely to be implicated in neurocognitive disorder, substance and medication use.